So I'm Lindsay Morgan. I am a child neurologist, but I wear many hats. I focus my time in the hospital on the neuro-critical care setting, and I do a lot of inpatient EEG reading, but I also go up to Alaska for outreach clinic, and then I do a neuro-ICU follow-up clinic here, and I run the quality initiatives for the neurology division. Because I am so kind of spread out, my daily work is very different, day to day, even week to week, which drives my husband crazy when he looks at my calendar and tries to figure out what we're gonna do. But some days when I'm on inpatient service, I come here really early, I see patients that are hospitalized, I round with the residents, and then go home and I'm on call overnight taking phone calls on those patients, and that's a week at a time. If it's clinic, it's a 4-hour block where I go in and I see patients that have ongoing neuro needs. And then I have a lot of administrative time where I work on some of my research projects. I'm fortunate to be on a few different grants, and then also helping with the quality initiatives for the division. So kind of all over the place, and can sometimes work from home, which is nice. And then I go up to Alaska, which I think we'll talk about a little bit later. My research is, it's really changed over the years, and I finally feel like I have a really good idea about what my passions are and what role I want it to take. I focus my research on status epilepticus, so prolonged seizures that need medications to make them stop. And I focus a lot on out-of-hospital status epilepticus, so how can we help treat seizures quicker before a patient even needs to come to the hospital. And with that, I've used a lot of my quality improvement training to try to better the outcomes and see where the barriers are, what interventions we can do. And so even when I'm in the hospital seeing patients, if they have a new diagnosis of epilepsy or they've come here because of status epilepticus, I make sure that they have a good plan for when they leave the hospital. With that, I've also found myself having a lot of interest and kind of some initial foray into research on sudden unexpected death in epilepsy, which is something that any epilepsy patient can experience. Some patients we know are higher risk and lower risk, but we don't talk about it very much as neurologists with our patients. And so a lot of my research is focusing on how to improve that communication, how to make my colleagues feel comfortable with that really important discussion. I first wanted to say I'm incredibly fortunate to have both of those opportunities. When I came, our old division head was just leaving, Sid Gosby, and he set up outreach clinics in 4 sites in Alaska: Ketchikan, Sitka, Juneau, and then Bethel, which is far north, 400 miles due west of Anchorage. He was leaving and needed people to take over his roles up there, and so myself and my colleague, Dr. Kate Otten, were fortunate to be offered that position. So I go up to Alaska to 3 of the 4 sites. I don't go to Sitka. Kate does that. She doesn't go to Ketchikan. And I go to each of the sites twice a year for a few days of clinic each time, and I see mostly Alaska natives. And really see any type of neurology that walks in. We can be incredibly busy at times, and it takes a lot of kind of problem solving to figure out how to get them the best care when we're only going up twice a year, as well as when a lot of them are traveling up to 100 miles to come and see us in that remote area. So it's really helped me figure out how to utilize the resources that I have, and to really train the other providers that are there on the ground all the time. And that's where the pediatric epilepsy echo came in. And that was because a lot of what we see in neurology is epilepsy, at least in pediatric neurology. And so while a lot of general pediatricians are comfortable saying like, yes, this is a seizure, a lot of them are not comfortable starting the initial medication. They're not comfortable with a lot of the comorbidities that can come along with epilepsy, things like headaches, depression, challenges with ADHD. And so we, myself and one of our now graduated residents took on creating this echo and outreach to pediatricians across the region, mostly ended up in Alaska, to hopefully help them have some more comfort with pediatric epilepsy and then with the comorbidities, and also just knowing who to call and having some resources for those more complex patients. So I went to University of Michigan, go Blue, and they didn't have a specific pre-med undergrad degree. I knew I didn't want to do a general science degree. I wanted something that also had some humanities in it. And at Anthro-Zoo, I had no idea what all it entailed, but I knew that it crossed a lot of boxes off that I needed for pre-med as well. And I thought it just sounded really cool. I've always loved animals, and so I thought, what better way to kind of blend some of my interests. I do not use it in my day-to-day life, although I can still tell you some random things about what does a female pelvis versus a male pelvis and like some very old hominids look like. But I mostly use it to just say, you can do whatever kind of career you want and still end up within a science field. I've just always loved kids. I had some experiences as a child in the hospital, and so I knew early on that I really was interested in medicine. And it's just, for me, I love talking with children. I find it just really fun to be able to play with them as part of my day-to-day career, and I'm playing with them but also learning from them at the same time. And I used to joke that, infant poop smells so much better than like adult poop, and so I don't know, for whatever reason, and you can feel free to delete that part, I just have always had a connection with pediatrics. And then when going through medical school, even early on, having those times interviewing adults versus interviewing kids and their parents, I just felt myself more drawn to the pediatric side of things. I think it's really helped me understand a very diverse America. So there's a lot of different cultures and socioeconomic status classes in all the places that I have studied and all of the people that I've interacted with. Medicine is practiced different in each region. The diseases and conditions that are prevalent in each region can be different. I never saw botulism until I came here, and it's not even in Seattle, it's in Eastern Washington. And so I feel like I've just learned something at each step along the way. It's also really let me see how different areas work with the resources they have. Detroit and Chicago are very urban, and so everything is really concentrated, and infrastructure is a lot different in Chicago than it is in Phoenix and the greater kind of Arizona area. And so when I came down to Phoenix, it was an eye-opening experience to know that I was seeing patients from the Navajo reservation 6 hours away that had no way to get to me and needed to borrow transportation. So I think it's just been a really humbling educational experience to be in various parts of this country and see what a melting pot we really are. We had this thing called the Undergraduate Research Opportunity Program, or UROP, at Michigan. I got into it in my freshman year, and it is where you kind of interview with different labs and do some research. And I ended up in 2 different labs throughout my 4 years there. Both happened to be neuroscience labs, which like looking back, I was like, oh, wow, this makes sense. So I got interested in this. But it really helped me because I was able to understand now kind of the importance of bench research and know what my kind of non-clinician colleagues are doing and how that translates to what I'm doing at the bedside. So it's given me a better just gratitude for their work. It also let me delve into research really early on and see, what it means to make a hypothesis and to follow through with the study, even when you want to call it quits because it's really going poorly. I would say it would be to really take time for your friends and family. There's always time for studying. There's always tests, there's always deadlines. And I didn't appreciate that at times. And I look back and there were definitely some experiences that I missed out on that I wish I would have just been like, you know what, I can take 4 hours to do this. Those relationships you have with your friends and family, they're the things that are gonna hold you through during the tough times. The obvious answer is going to Alaska and being able to care for that population up there, and then just being part of UW and having the WWAMI region in our network. I have also noticed through the years that some of our national conferences are focusing more and more on equity, particularly for rural communities, which I am a big proponent of, or advocate for, I should say. And so I took part in a health equity special interest group at American Epilepsy Society this past December, where we discussed how we can improve epilepsy care to our rural communities. And I am part of a working group through the American Academy of Neurology to put out a position paper for how the AAN can help advocate for the neurologic community, again, in a rural setting. It's let me be a little bit more comfortable with the unknown. Neurosciences as a whole is still such a young field. We're still learning so much, and I love puzzles, and I love trying to figure things out. That being said, it's also let me, I hope, become a little bit more humble and understanding when I think I have the answer and then I'm thrown a curveball and I have to start fresh again.